Welcome to week 3 of the chain programme. I'm going to talk through what we're going to cover today. We're going to review and recap the previous weeks. We're going to talk about the benefits of exercise for osteoarthritis. We're going to talk about how to pace exercise, how to balance the rest periods with your exercise periods. And we're going to have to recap on a new element of cycling technique for you to learn in today's session. So, just a reminder, having osteoarthritis of the hip is not uncommon. In fact, nearly 11% of the population over the age of 45 have osteoarthritis of the hip. So it's something that is important that we treat well for both yourselves and for society. But what can cause osteoarthritis? Well, osteoarthritis can be caused by many different things and combinations of different elements. But in general, it can be caused by obesity, and if you're overweight, that puts additional pressure through the joints. It can be accelerated by bone and joint disorders, such as rheumatoid arthritis and other different types of joint disease. Genetics can have a predisposing factor. So if your joint isn't quite properly aligned, that due to your genetics, that can accelerate wear. And repetitive joint injury can accelerate wear. So maybe you had recurrent injuries in earlier life, which has meant that you've had accelerated wear through your joint in later life. What we see when people have osteoarthritis is normally we get a characterisation of muscle weakness around the joint. This muscle weakness can be bilateral, so not just the affected side but also the unaffected side. We find that muscles are reduced in size. We also find that muscles can be inhibited. The pain can inhibit the way the muscles work, so that means that they don't function properly. And we also get decreased muscle quality, so the quality of your muscle contractions isn't as good as it could be. This is also accompanied by other comorbidities which are prevalent in people with osteoarthritis. What you may not be aware of is that if you've got arthritis, you've got increased risk of metabolic, cardiovascular and mental health issues. So metabolic syndromes such as diabetes and high blood pressure are much more prevalent in people with osteoarthritis when compared to people who haven't got osteoarthritis. Cardiovascular disease is the same, so things such as high blood pressure are much more likely in those people with osteoarthritis. And depression and anxiety are also heightened and more prevalent in populations of people with arthritis. So what can we do about this? Well, according to the experts, everyone who has arthritis should receive education so that they know that exercise and increasing their physical activity levels will actually help their joint pain. Also so that they can manage their weight and feel much more positive about their condition. We know that some people may benefit from drugs or injections, and in actual fact, very few people require surgery. So why exercise? Well, if you read The Lancet, which is one of our most prestigious medical journals, there are now over 20 chronic illnesses and diseases that benefit from increased exercise or physical activity. And we've got a few just on the screen here. If you exercise, you'll lower your risk of cardiovascular disease, you'll lower your risk of diabetes, you'll reduce your risk of falls, you'll help to control your weight, you'll benefit from improved psychological well-being, you'll find you'll have increased stamina and energy, stronger bones and muscles, and also increased mobility and flexibility. So why cycling, and why is cycling so good for hip osteoarthritis? Well, when you cycle, you're doing between 70 and 90 revolutions per minute of your hip joint. You're doing end-range repetitive mobilisation of your hip joint. And in actual fact, you're using your other hip to drive the affected hip round. What this results in is mobilisation of the joint. It gets looser. It also strengthens the muscles around the hip joint. And also, because we're doing a cardiovascular exercise, you get that release of happy hormones or serotonin that provides you with pain relief and provides you with that high that you feel after exercise. So you get that cardiovascular benefit, that increased improvement in stamina, as well as the local responses around your hip joint. So cycling is also great because it specifically strengthens muscles which we know get weak when you have hip osteoarthritis. Muscles which we know weaken with hip osteoarthritis are your gluteals or buttock muscles, your quadricep muscles or anterior thigh, your hamstrings, your posterior thigh, and also your calf muscles. All of these muscles conveniently are exactly the muscles that we use when we cycle. So as you pedal and as you go through the pedal stroke, you'll recruit each of these muscles at a different point. So we're strengthening the muscles that we know that get weak, and if we strengthen those muscles, we help to offset the load going through the joint, and we get more mobility, more strength, and hopefully more function and less pain. So whilst we're exercising, we also need to think about pacing. So if you've not exercised for a while and you're getting back into exercise through this program, you need to slowly increase the load. If you try and do too much too soon, you'll probably feel a bit sore. If that does happen, that's no problem. Just take a couple rest days and then go back to progressively loading. Again, you may think that you may want to add some other cycling sessions in through the week. So don't do them in consecutive days. Give yourself a couple rest days in between your cycling sessions. It's important that we get good rest and good sleep in between our exercise sessions, because that makes the exercise more beneficial when we do it. Exercising when we feel ill or when we're tired actually won't have much positive effect. Far better to give yourself a rest day and then come back the next day when you're feeling better and exercise then. Let's hear from one of our past participants who's going to tell us about their experiences of the chain programme.
It was always stiff, often painful, and I thought it was going to be a steady decline. I thought it would just get worse actually, so I stopped doing certain activities, sports, badminton, and tried to look after it the best way I thought, to protect it really, not to wear it out anymore, and just to take things more sedately. I learned the opposite, that I should be using it and not to be afraid of exercise, and probably more the better really, just to try different things, not to be afraid of it.
We're now going to give you some tips on a new part of the cycling technique that we're going to learn this week as we go into the studio.
Okay, so in this week's spin session, we're going to concentrate on an even pedalling action. So the tendency sometimes is with hip OA is that if you have one hip that is more uncomfortable than the other, the tendency is to use your good side. But what we want you to do is really concentrate on working both sides evenly. So think about an even pressure through both feet, both knees and both hips.
So, in summary for week 3, we've recapped that muscles get weak when we get osteoarthritis of the hip. We've recapped that exercise can help strengthen and increase mobility in our hip, but also it has many other physical and social and psychological benefits as well. We've flagged up that cycling is an excellent low impact exercise for the hip joint, but also for increasing our general cardiovascular fitness and stamina. And we've emphasised that the muscles that we use when we're cycling are exactly the muscles we want to strengthen, because those are the ones that get weak when you have hip osteoarthritis. Thank you for listening, and I hope you enjoy your session.